Here is a patient who has chronic SVC obstruction. And so when you inject contrast through the venous system in the upper extremities, the contrast has to get back to the general circulation. And one of the ways that it can do so is by entering through the liver. And so I want to show an example of that. In this particular case here, we're now in the liver, and you can see that the liver is demonstrating a strange pattern of enhancement. And this pattern of enhancement is only seen in the segment 4 of the liver, or the quadrate. And so sometimes is referred to on nuclear medicine imaging as the hot quadrate sign. So this is the CT equivalent of that. And what's happening here is because of the SVC obstruction, there are many pathways in which blood is being bypassing the SVC and entering back into the circulation. And one of the ways it does so is through this collateral pathway here, which is known as your superior vein of Sappey. And your superior vein of Sappey is one of the veins that drains through the falciform ligament. You can see the falciform ligament right here. And this actually drains into the quadrate lobe, or the fourth segment 4 of the liver. And so this leads to an abnormal enhancement pattern, particularly seen on the arterial phase. When you see the more delayed phases, I'll pull up the portal venous phase right here, the enhancement looks almost identical in segment 4 with the rest of the liver. And so this is referred to as the CT hot quadrate sign, in this particular case caused by SVC obstruction and collateral pathways developing through the vein of Sappey.